I'm George Latos, Area Director of Publisher at Invasive Publishing, Orange County. I'm speaking today with Victor Rusenescu of OCPT, Orange County Physical Therapy, located at 2135 Westcliff in Newport Beach. It's one of South Orange County's top choices in physical therapy. Victor is not only a physical therapist, but he's also an athlete, so he understands the issues associated with movement. And in full disclosure, Victor was able to alleviate my back pain and my lower hip pain. So Victor, why choose OCPT?
I think reputation is the biggest. We have a lot of people that they come to us and they like to refer their friends and family, and that shows a big part of being able to be trusted as a provider. So I think that's a big part of it. Also, doctors that work around the area with us, they send their patients that if they have someone that really is looking for the best, they send to us, and not just give them a list of orthopedic physical therapy clinics around. So they say, go to this place, you need to go here if you want the best. So this is the big test to why we are premier and why we're so sought out for the best type of physical therapy needs.
I was really impressed with the one-to-one association that we had, and I know that's a big part of your business. Talk a little bit about how that came about.
Yeah, so if you've ever had physical therapy in the past, you might have gone to a facility where you have maybe a physical therapist work with you for about 5, 15, 20 minutes, and then they'll hand you off to an aide or some sort of assistant instead of them themselves watching you, the doctor of physical therapy. So that model works for a majority of people, maybe half of them, but I wanted to give back to the patient and open this facility here in Newport Beach because I felt that the patient really needed the doctor's attention the full time that they're here. So there isn't no use of aids. So the doctor of physical therapy is working with you the entire time during your physical therapy session. And that provides faster recovery times, I believe, and patients feel like they're valued as a patient instead of just a person that walks through the door as a number.
Right. Newport Beach is a mixed society of young and old, but we do have a fairly large older population. And I know a lot of my readers living in the neighborhoods that we service are older readers. Do you have a lot of people who are my age and older coming in for different ailments?
Maturity is a great thing to treat, Definitely, our practice treats a variety of ages from 8 to 90 years old. We have protocols that we've developed for, the younger person to the one that's more mature in age. So, when you're 75 post-surgical knee replacement, our protocols are definitely geared for you to get back to what you love to do at 75 years old. So we're not going to have you do jumping jacks if that was something that you weren't doing before or not wanting to do. So protocols are a good way to ensure that you're giving the needs to someone that is later in age. And we have protocols for someone immature in age. And we definitely look at those things, age, comorbidities, whatever it may be. And we definitely attribute our success to being able to create programs made for that specific age group. It may be mature in age or later in age in life.
Great. So obviously COVID is on everybody's mind, and COVID has changed many different industries. How has it impacted your business, and what have you done as a result of COVID?
Well, initially, our best practice is to keep clean, is to make sure that one-on-one treatment that we provide is still being done, but we also still have private treatment rooms that we treat in. And then, everyone's within a means of being 6 feet apart, wearing a mask when they're being treated. If they want us to wear a mask, then we wear a mask as well. We're definitely wearing masks when need to be in the clinic. We do ask we ask symptoms before they come in. If they have a cough, feel body aches, chills, we'll take the temperature and go from there. We definitely disclose that information to them and ask them, and they disclose it to us before we treat them on a daily basis. So that's one way we do it, as if you were to come in the clinic. Another big part of this whole transition was learning how we can give back to the community that cannot come in, or they just, they have underlying issues that they don't want to expose themselves, regardless if I wear a mask or spacesuit. They really want to benefit from physical therapy. The industry has provided, and healthcare has opened up the doors to using telehealth as a part of it. And now we incorporate telehealth through Zoom, through any type of meetings that their persons can use an iPhone, and we go through a session. They can be a first initial visit. We do initial visit, go through it, see what exercises we can do, perform together. It can be through a phone call as well if they don't want to see a video format. So we do offer telehealth, and insurance companies are, you can use your insurance through it. Medicare is one of them, Aetna, Blue Cross Blue Shield, they're all allowing telehealth calls if you choose to stay at home. And we can provide still a good service for someone, instructional exercises, routines, breathing techniques to help alleviate the pain that you may be having sitting at home or whatever you're doing.
Sounds like a great way for even a current client to
Yeah.
come in if they can't make it at that.
Yeah, we have maybe about 15-20% that are still staying at home, and we see them twice a week or once a week, and we go via telehealth or a phone call and ask them how they're doing, and then we update, send them pictures, videos. We send them to our YouTube page, which has all their instructional videos of exercises. So if they forget, they can just log on to our website or our YouTube and see what we were discussing.
So let me ask you this. You've written some articles for us in the publications, which were very, very well received. One that I thought was very well received was the difference between a physical therapist and a chiropractor. Just give us a couple of moments and share the differences there, because most people are confused between what a chiropractor does and what an actual physical therapist does.
Yeah, I mean, the biggest thing that we as physical therapists focus on is movement patterns, understanding how someone moves and why they're having shoulder pain, let's say, for instance. We look at not only the shoulder joint, but also the neck, the spine, and muscles surrounding those areas. So we definitely look at movement as part of the issue, not just the shoulder joint itself. So we would say, we would call ourselves movement specialists, and not just adjusting the shoulder joint itself or the spine itself, but we look beyond that and being able to hone in on, through proper exercise routine, proper manual techniques, may it be joint mobilization, or you would say like cracking someone's neck or adjusting someone's neck. Besides those techniques that most chiropractors do of adjustments, we do those as well, but we take it beyond that. We adjust and mobilize and take them to the new movements, into new range of motion, and give them strength in those new capabilities to allow healing to happen in a new function. So that is the biggest things that we like to keep people moving in the new movement that was created, either through an adjustment or through massage or some other technique.
There's also a fairly large difference between the amount of education required. Is that not true?
Yeah, I mean, we definitely have to have a bachelor's degree to get into a PT program, physical therapy, a postgraduate program. And all graduate programs now are a doctorate level, no longer a master's. So, there's quite an education that goes on, 7 years. It depends on how fast your undergraduate is. If you standard 4 years, then 4 years plus another, 3 years or 2.5 years, depends on how fast you do your graduate program. But so it's quite an education. It's kinesiology. Most undergraduate degrees are for physical therapists are kinesiology majors. I was a science major because I didn't know if I wanted to be a PA or a doctor. But I went to PT because I love sports and got to really spend one-on-one with the patient.
And your favorite sports are?
I played a lot of tennis in my lifetime. Still play tennis, monthly, but I'm a big avid cyclist and runner now. Not much swimming anymore, but definitely avid cyclist. Play golf once a month. I can probably do most things that is under the sun that has to do with sports. I like to do a lot of things alone, so I can think a lot. So that's why I cycle a lot. But overall, you know, cycling is probably my biggest these days.
That's great. Well, Victor, it was really great catching up with you, and we
Yeah,
really
thank you,
appreciate all the information.
Thank you.
And we will chat again soon. And if you want to get a hold of Victor, you can go to their website at ocptclinic.com or call them at 949-379-8400. Again, thank you, Victor.
Thank you, George. Thanks for having me. We'll talk to you soon.
Yeah. Bye-bye.